The pandemic has challenged our concept of what a normal work week should be. What we have now is an opportunity to really learn from that. There are a lot of advantages for people for being able to work from home that allows them to have a more balanced life and think about other aspects of things that are going on and eliminate sometimes a tiresome commute. Being in person, though, is also something that can sometimes be important. We've seen that now of 2 years being apart from colleagues. And so I think that the right answer for us is going to be somewhere in between that takes the best of both of those worlds, allows us to have a community, allows us to work together collaboratively, but also gives us the flexibility and recognizes that we're all humans that are balancing a lot of things with work and home and our social lives.
Telehealth has changed mental health, in my opinion, drastically. There were so many people who just couldn't get to therapy before. But now what we're seeing is people are going to therapy during their lunch breaks. They're going early in the morning because they don't have to commute to the hospital or a community mental health center. They're just right there in their house going to therapy. So it's created a way for people to have more access to mental health treatment. And it's also good for providers too, because we're able to see more people. So that allows us to help more people.
The main thing I see for young people coming out of this is they've had some losses. Some of them have missed their prom, some of them have missed graduation. A lot of the decisions that were made for them, they were not consulted. And I think that's something that our society has to do a better job of. If we're going to support people, we have to talk to the people who we say we're supporting and to ask the right question. And then, as adults, to listen. Sometimes, as parents, as authority figures, as teachers, educators, we may ask questions, but we don't often listen. We need to really allow them to be part of their own solutions and take them seriously. And I think that's the main thing.
We have seen some changes recently in people's receptivity to talking about mental health issues and seeking help. One of the issues that I think is lagging behind that a little bit is that it's not evenly distributed among different kinds of cultural groups and backgrounds. And I think traditionally people have been pretty quick to say that maybe some communities of color or different backgrounds have more stigma than others. But I think one of the things that we're increasingly seeing is that stigma is sometimes driven by people not feeling like they're going to be able to talk to somebody that understands them or has a similar background or maybe represents them. And so I think one of the still lagging parts that we need to work on is getting people to be able to interact with people that kind of understand them and make them feel supported.
The pandemic has exposed mental health care disparities. It's been hard for people of color to find providers. Right now, what we're seeing is there is increased demand for providers and not enough providers. But we do know that certain communities have more access to those providers because of resources, because of different health insurance plans. And what we're seeing is the communities that don't, they're going without that treatment. But thankfully, one thing that we are seeing is that communities are coming together and really supporting each other. So that's something else that we as professionals have to do. We have to work on equipping our community leaders so that when they go into the communities, they know what to look for and how to recommend that people actually go and get the care that they need.
We talk about whole person healthcare. And what that really means is when you have mental health need, that really affects every part of how you work on your daily basis, right? It affects your ability to do your job, to care for your family, to have those social connections. It also affects your ability to take care of your physical health, whether that's looking at preventive services or managing your diabetes or your high blood pressure. Taking care of your mental health is essential for you to be healthy and successful.